Hello, everyone. This afternoon, I will introduce you to the Russian bioresinance Metatron and the benefits of this technology in supporting dry fasting. So, there's nothing better than practice. So we have a patient here who is not on a dry fast. So if one is not on a dry fast, we can obtain a very precise diagnosis. So we will put the headset on him for analysis. This technology is 30 years old and was highlighted by the Russian professor Vladimir Nesterov from the Institute of Psychophysics in Omsk, Russia. So it's an institute that has been developing with researchers, scientists, mathematicians, and researchers who have been advancing this technology for about 30 years. So this technology is a technology used in Russia, exclusively reserved for doctors. Therefore, non-doctors in Europe, like me, as a naturopath, I can use it, but it is normally reserved for doctors. So we are dealing with a truly avant-garde medicine, futuristic medicine, which will conduct an analysis, a diagnosis, a health assessment for naturopaths. We call it a health check. And then we will be able to conduct a comprehensive evaluation of a person's health status at a given moment. I also use iridology, which is a method of analysis where we can see more of the past, present, and future. But here, the analysis is really focused on the present, on the current health of the person we are analyzing at this moment. So this device will send an infrasound into the body, and then I'll ask you not to touch, indeed like this, to avoid interference, and to keep the body like this without crossing. And then the infrasound will travel through the body like this, and it will overlay onto a database, and then I'll talk to you as we go through the assessment, and that's how we analyze, how we interpret this data. So this technology was mainly used by Professor Nesterov, who worked for the Russian NASA, who was responsible for restoring the health of cosmonauts returning from space. So it's really a device not meant to treat symptoms, but one that truly works on the entirety of a person and their entire energy system. We are dealing with the medicine of information and energy. Every organ, every tissue, every parasite we encounter, or bacteria, regardless, viruses, has a frequency spectrum. And the device has recorded all the frequency spectrums of a vast number of tissues, healthy, moderately healthy, unhealthy. This means that by analogy, we can reproduce an exact diagnosis with precision between 90 and 100% accuracy, comparable to an MRI and a scanner. It is the only device with clinical, scientific, and medical validation. There are many devices, unfortunately, that exist in France, which are entirely copied from this system. I won't mention brands, but I think if you do some research, you'll find out which ones are the copies. So this is a device, original, a medical device. So it's not at all in the same price range as the devices you find copied, which are widely available in Switzerland, France, Belgium, without naming names. We are going to proceed with the analysis of this person. To return to these stories of cosmonauts, he evaluated the health of these cosmonauts when they returned from space. It allowed them to be rebalanced, brought back into harmony, and given non-invasive therapies. because this device is non-invasive as it analyzes tissues, organs, and there is no invasiveness like a scanner, an MRI, where contrast agents, which are often toxic, must be injected. I noticed with over 10 years of experience with these technologies that people who had just had a scan, an MRI where they had injections beforehand, I saw that their kidney was still very damaged. It's very lesion prone. Whereas with this assessment, in 4 minutes, we really have a set of information that helps us with the diagnosis, which helps us understand the underlying cause of an imbalance, which systems are affected, where we will focus our attention as practitioners of global holistic medicine. We work on all levels, physical, mental, emotional, spiritual. We work on that. And this device will address the weak links by making energetic corrections on systems, on organs, and we can also deworm, as you will see throughout the presentation. The interest in Genesex is really to do it beforehand and then see where you stand. It can also be used during Genesex to see where you are, which systems are becoming unbalanced. We can do it if there are those who are curious to see. Generally, there are changes during Genesex that occur at different levels. We could have fun measuring, seeing what worsens during a Genesex, how the organs are, how they function, and then the interest is in stimulating the organs. So for those interested, we can work on a liver, stimulate its drainage, stimulate a kidney, stimulate drainage, regenerate the organ during the Genesex. It's definitely something interesting to do. We will restore, if you like, the tissue, the organ to its original and healthy state with a frequency spectrum that is sound and in good health, in good shape. So I select my patient. We do not necessarily need to put your name. We'll put Petrovac. We'll put a name, a date of birth. It's not very modern. Whatever it is, it's not important, but if you want, the blood type, there's no need, that's not what's most important. So I have patients who came, who wandered for years in medicine. They went from doctor to doctor, from therapist to therapist, without understanding, without looking further. And well, they arrive, and it's true that in 4 minutes I explain to them where their problem came from. This device truly has its benefits in handling a case we don't understand, but also, of course, cases we do understand, because we will be able to make connections and work on systems. So here I start the measurement. We see a red curve and a blue curve. So this is the basis of this technology we call NLS, nonlinear system. So this infrasound is launched. There are two curves that suddenly appear, a blue one and a red one. So we are on the blue, we are on the anabolism, the anabolic health of a person, and the red curve, the catabolism. So everything that is elimination and then construction, the blue curve. But also we could say the structure of an organ corresponds to the blue curve, and the function of an organ corresponds to the red curve. One could also say we send a signal, which is the blue signal, and the body responds on its own, am I healthy or not healthy, by the red color. So we can see a person's physiological disorders simply through a simple analysis. So here we see, apart from this little imbalance, that the curve isn't so bad. The more curve deviations we have, the more imbalances are indicated, which become apparent. So the crossings aren't that important. What matters to us, what we like to see, what interests us, are the curve deviations between the two curves. And the red curve, we try not to have it above, because we are in a somewhat pathological state. If the blue curve is very, very high, we are more on the side of allergy, inflammation. It's better to have the blue on top than the other way around. So we see differences of 4 tiles diagnosed. I don't like the word diagnosis because it's reserved for doctors, but we could assess cancers, things like that, if we really see crossovers. For example, here we see that she probably has small stones in the gallbladder. I made a mistake, liver, the gallbladder. I was wrong, it's not a big deal. My English makes mistakes sometimes, so we start the analysis and it continues. We see all the organs that have been scanned. We won't see all the images, but everything is recorded. We'll see if there are bacteria, parasites, etc. We can see the circulatory state. We can assess how it circulates in the vessels, everything. The muscular system is analyzed. We know the condition of the muscles, so we see that his muscular system is perfectly fine. For you, during the retreat of I don't know what we do, you can come and have your session at any time you want. In any case, there is no impact on fasting. It won't stop eliminations. On the contrary, it will energize you. It will accelerate eliminations. It can have a regenerative effect on the organs. There are no interferences because we are dealing with energy medicine. We are more energy, information, light than matter. An atom is 0.0001% matter. We are truly an energetic being. At 99.99%, we are energy, light, information. At 0.0 and 1%, we are physical matter. To convey information, the best way is through information, energy, and we will use solutions that we will charge and prepare all kinds of remedies, whether in parasitic situations, antidotes, or treatments. Remedy, therapy. Remedy. We also have the spectrum between 1 and 6, so ideally it's best to have 2 yellow. Yellow is ideal, there you go. The darker we go, the more there is a pathological state that might be present, there you go. So here we have reached a global analysis, so we look at the intestine. And what do we find? We find a trace of Candida albicans in the digestive part of the colon, and we find this bacterium, this well-known Candida albicans, and then there we can ask the person a simple question. That corresponds to the analysis. You should know that Candida albicans, what does it do? It is very attracted to anything carbohydrate based, especially sugary. So the more we have, the more it makes us consume sugar. So it's no longer us who are in control, but it's the Candida albicans, because it has taken too significant a place in the intestinal flora, in the digestive flora. And then we're at the supermarket and we see chocolate, we see chocolates. How much? Sad gram? 300 grams? Oh dear, 300 grams of chocolate per day is a lot. So there you have it. These are people who are drawn to sugar, carbohydrate products, because there is an excess of Candida albicans. So we need to do something. So how do we proceed? We are going to perform an initial deworming of this Candida albicans. We press on the meta correction and it will deworm this bacterium for us. Now, I'm not saying that in one session the Candida will decrease in her. We all have bacteria and fungi within us, but some gain too much strength, too much magnitude, so they need to be calmed. There you go. So here we see that there is a deworming. Ideally, it would be best to have at least 4 or 5 sessions to manage this. And then we can also prepare an antidote vial, Candida albicans in this vial that we can prepare. We'll see later how to do that. There you go, so we've dewormed. There you go, so we're moving forward. So we look at the state of our intestine. Well, we see that it's not so bad. There are no major curve deviations, so digestion for the intestinal tract is not so bad, it's normal. Digestion is okay. Yes, of course. She says, okay, well, there you go. It matches. Okay. I don't understand what she's saying, but it's not. Okay. So there you go. So we're going to move on. So there he just pointed out the Candida albicans in the colon area. There you go. That's what he tells us. So it doesn't hurt to do a meta-correction of the digestive system, because the liver and the intestine for me are the most important organs, because most pathologies come from there, except for everything that is psycho-emotional. But on a physiological level, it's always the gateway to all diseases. It's the intestine. Hippocrates said it 5,000 years ago. There is nothing new. So you should know that most autoimmune diseases stem from a leaky gut, what is called the leaky gut syndrome, and toxins, bacteria, food products pass through this intestinal lining and create ripple effects, antigen passages into the blood that will be the start, the gateway to an autoimmune disease. It can attach to a thyroid, cause Hashimoto's. It can attach to joints. It can cause polyarthritis. It can create all sorts of pathologies because the entry point is digestive in this area. And then we have the liver that will process the toxins. So Sergei Filonov focuses a lot on the liver, but very often attention must be paid to the intestine, which is also the cause of many health problems. Therefore, focusing on both is truly the strategy to adopt. Detoxifying the liver, working on the liver, regenerating it is great, but upstream, you must always consider the intestine. What is the condition of the intestinal mucosa? In Ayurvedic medicine, they overlook this. They are unaware of this aspect. They treat joint and rheumatoid pathologies without understanding these mechanisms. They focus only on the symptom, but they don't realize that the cause stems from a digestive imbalance. For instance, having been to India several times, I found they were surprised to discover this concept, which has been known for quite some time. So our idea is to work on this intestinal barrier, to restore it to an optimal state, and then prevent a protein called zonulin from being present, which is a protein that can be found in certain analyses. There is also calprotectin, which is something we request in biology, in the lab, to scientifically evaluate medically the permeability of the intestine. But our bioresinance also provides us with indications on this. So here we initiate a treatment specific to intestinal regeneration, which we call metatherapy. And it's the main tool of this Metatron technology. So we can do it multiple times. If the organ is severely affected, we could do it several times to stimulate and regenerate it. So here, if we're talking about stem cells, we could say that we're constantly regenerating tissues. So we could treat diseased knees, areas that are pathological, by providing regular stimulation. It generally takes 5 sessions to regenerate tissue using this informational technology. So here we will always see our little bacteria and discover that there is a Staphylococcus aureus in the gallbladder, a small bacterium. So here too we can have fun with parasitizing. Everything we see in green indicates infections that are localized in specific areas. It's clear that some think it's science fiction, but it's quite precise and we can really have an overall view. A comprehensive picture. Break time 0.4s. In an hour you can get a little understanding of what's going on with a person. The idea is to show you a bit of the systems. We're going to explore some things here. So we can still see a bit of the adhesive there. Break time, but the curve isn't bad. There's a slight deviation here. We're looking at the immune system so we can see that we need to pay attention to the immune system. The kidney too, there's a slight deviation here, but it's not something too significant. The thyroid is doing quite well. This is a curve that's not too bad. It could be a bit closer, but ideally this is what we're aiming for, a curve like this, blue. We have the structure of an organ, its function that fits, and here it's quite good. So here we are in the cerebral circulatory system. So here we can see that it's a bit lacking in this area. We have a curved deviation here, so we think it could circulate a bit better in this sector. Here we have the bone level. We can assess osteoporosis. We have bone issues just with this analysis. So we can simply, I have people with osteoporosis, so we make corrections. We make 3 corrections, and people come regularly, we make corrections, and in this way we try to manage osteoporosis phenomena. After that, it's not just that, it's a therapeutic approach. I'll show you how we use remedies, for example. So, for example, we could imagine, so here it's a 58-year-old person. We could imagine helping them on this level. So we go to the remedy database, and then, for example, we would enter, for instance, cartilage, complex joint. So here it's an organotherapy database. So all the remedies, all the frequency banks of all the remedies are on this device. So we can, of course, provide glucosamine sulfate, chondroitin, which will help the cartilage. We can give omega-3s, anything we want, but there's no information. We are on weight dosage. Here we really have the information, and it allows us to truly act on the energetic system, thus speeding up, accelerating a person's healing. So, here, complex bone, we could give complex bone. It's really what we give for osteoporosis. And then I put my remedy, my little vial. So it's just a tiny bit of alcohol with water. And then we put that in the preparation room. So we make our own remedies. So we no longer need to go to a pharmacy. We prepare our own remedies. However, that doesn't prevent us from giving additional plants in weight to support and have a double effect. That's what I do. So having a double effect, the more actions we take, the better, without going overboard like some therapists who prescribe remedies that make absolutely no sense. There are well-known doctors, I won't name them, but you end up at the end of an appointment with 25 dietary supplements. It makes no sense. I try not to use more than 3 or at most 4 remedies. Otherwise, it's too much. You have to go one after the other, but not give 25 remedies at the same time. It doesn't make sense. So I'm launching my production of EUSS complex. In his case, it's just to show you, but well, there wouldn't necessarily be a need, but a little bit anyway. So we prepare EUSS complex, and we really have our remedy that corresponds to osteoporosis, for example. You see the images on the screen a little. I can't tell what you're seeing. So EUSS complex. Then we have a whole database in biochemistry. You see calcium levels, copper, there you go. So these are all biochemical data that we can analyze more or less. So we can look at the iron levels. There would be a need for a bit of iron, etc. Well, we're not going to get into those details, but we can do a biochemical analysis. Here he's going to mimic a little bit in terms of pathologies. So I rather like to go and see about the pathologies, rather look into that. There you go, he's pointing out the intestine to us. It's an important area he's indicating we should check. It's one of the quite important things for his Metatron chart. So it's the intestine, a little bit the thyroid, a little bit the vaginal mucosa is indicated, but it's not very high. So we're not dealing with someone with a severe pathology or significant problems. Then he shows us nosological forms. So he sees a bit of candidiasis. I think it's going to create a slight digestive imbalance. So there's a small mistake, it's dysbiosis, not dysbacteriosis. There you go, a bit about the thyroid. And then he tells us about the candidiasis, which is confirmed by his need to consume, in conclusion, a lot of sugar, a lot of chocolate, because it's this bacterium that has taken over her. So there's a whole therapy to be done parenterally, but also with these informational remedies. So from here we stop. There it's thrombophlebitis, you see. It's things, there's nothing, it's too far from zero. The closer it gets to zero, the more we're dealing with things. There you go. So we can also see certain bacteria. So we see traces of Clostridium difficile. So we could definitely make a second vial. So we don't mix the vials, the remedy vials and the antidote vials, we don't mix them. They can be given during the day at different intervals, morning and evening, for example. There you go. So there, well, we're not going to, but we should make him a Clostridium vial. A second vial would be needed to counter this bacterium we see here. There you go, we have the bacterium, so we should make him an antidote. Program him a remedy for that, there you go. That could be another time. We have the viruses, the bacteria, there you go. So we have traces of a reovirus, but it's not very virulent. There you go, we have all the preparations, I mean allopathic. Let's imagine someone who is on chemical medication, monitored by a doctor with a prescription. You can find all their medication here in the list of information. And then one could support with a bioresonance remedy to potentially reduce their medication intake, for example. So there you have it. Regardless of the medication, it could be provided as information without the toxic effects of a drug that poisons you, you know. Of course, there is a database with all sorts of remedies, diverse and varied, that are informed. So we have all the frequencies, the frequency spectrums, many remedies, whether it's all sorts of things that the device selects first by order of importance, but then the therapist can decide otherwise. We decide on something else. So there we will continue. We are nervous. It's a perfect quartet. So there you have it.